All right, so today we're just putting on X-Fix on our patient. So I've opened the Synthes large external fixator tray, and the doctor has asked that we do a spanning X-Fix. So I also opened the long X-Fix tray. A spanning X-Fix just means that we are going to be crossing the knee. So we would need longer bars in order to cross the knee and make it a really long X-Fix. Basically from the femur to the distal tibia is the X-Fix that we're going to put on today. So these are the longest bars that we have. If it's not long enough, that's okay, because we can actually put bars together to make it even longer. So I'm just going to run through these trays really quick and give you an overview and an idea of how we're going to be putting the X-Fix on. The first thing that we do is most of the doctors here like the triple drill sleeve. So we'll just put that together. That's the wrong one. That guy. So they'll put this on the leg, and we usually drill the pin sights before we put the Shands pins in. And since we're going to be putting in 5/0 Shands pins, we would pre-drill with the 4/5. So that's what this is for, to help them get the right spot on the femur and or the tibia in order to put the pins in. So they would put this down on the skin first, X-ray, make an incision, drill, and then we typically use long pins. These are self-drilling pins, and these are not, at this hospital, we usually drill even if they are self-drilling, but they go really long pins, especially for the femur, because of all the tissue. They want this to be able to stick out of the skin so they can attach bars to them. So I would pull out at least 4 of these. And they're different lengths, so you want to make sure you get them all the same length. So this one's too short. And they'll even have some in the bottom if we need more. I think there's some in here as well. So I'll have to find another one, but at the minimum we would need 4. We have 6/0 pins as well. Those are really big. We usually put those in the pelvis, so we should not need those a day. If they go into calcaneus, we have calcaneus pins, and they have threads in the middle of the pin here. I do not know if we're going into calcaneus, so I'm not going to get that out just yet. So once we get 4 pins in, so 2 pins in the femur, 2 pins in the tibia. Most of the doctors here like these 6-pin clamps. So a pin will be in here and here. They'll put this down and they'll tighten it with the wrench that we have here. And then we will use a bar, and since it's spanning, we'll use one of these bars. And we attach it to the pins using 2 different clamps, depending on the doctor's preference. So we have what we call combis. These are pin to bars and bar to bars. So they will attach to a bar or a pin, or both. And then some doctors like to use the pin to bar. They will only attach a bar to a pin. So either of those 2 options. I know specifically that this doctor, he likes the pin to bars. So I'm going to pull out mostly pin to bars. And a minimum of 4 on that as well. But again, we could add more if we have to start stacking bars to make it longer. Or if we have to attach 2 bars together, we can use a combi to attach 2 bars together. In the top here, just briefly, if they want to use the 6-pin, which is in my hand here, a lot of times they'll use this guide with your drill guide, because it lines up perfectly to all these little pins. So some doctors use this, and then they'll use this guide if they want to use the 6-pin guide. And then these Shands pins, you either have to chuck them on the drill, or you can use a quick connect. There's 5/0 and 4/0. We have 4/0 pins in here if they want to put a pin in the foot. But these just go right in there, and then they attach to our drill. And then we have a T-handle chuck. If they get the pin down in the femur and they want to just hand tighten it, they'll use a chuck. And then we just have 2 different types of wrenches, which they'll use to tighten the 6-pin bars and the combis and the pin to bars. And if for some reason they cannot get it like reduced enough, that we have these guides. that they tighten onto the bar, and then they can use a wrench to tighten it, and it'll actually bring the bar in tighter if they need a better like reduction or something. So that's what those are. And they usually use them in combination. So they'll put one on one side of the bar and pin, and then they'll put one on the other, and they'll tighten them down. So that's pretty much it. And these are just, this is the same tray, but it's just like longer stuff. And that's it.